Sir, you're welcome to Eyewitness News.
Thank you very much.
Yesterday we
My
spoke.
brother.
Yeah, thank you. Welcome. Yesterday we spoke. You explained why you felt nurses were not being treated well and why you have to be treated well. This government prides itself as a listening government. Indeed, today, 2 ministers and a deputy called a press conference to make an announcement to the nation. They have no difficulty with what you have said. They have not said you don't deserve what you are asking for. They are simply saying that the budget cannot sustain what you are demanding. In essence, they can sort you out, but not now. Does that sink well?
Thank you very much. And then good evening to your listeners and good evening to you and your team. What the minister said is in nowhere near what we expected them to see. You see, they are quoting 2 billion Ghana cedis. That is, if they are going to implement our conditions of service, it will cost the nation 2 billion cedis. It goes to confirm that they haven't even done any proper costing of our conditions of service. What is in it that will consume such a huge amount? Is it the fuel allowance, which is going for only senior nurses and midwives who are few? Is it the book and research allowance, which is going for just few tutors, about, let's say, 10,000? Is it the rural incentive allowance, which is going to be 20%, not 100%, 20% of the basic salary of nurses working in the private area? Is this amount that is going to bloat the amount to 2 billion cedis? There is clear demonstration that they don't take our issues as a priority. If they were prioritizing in the first place, it would have been captured in the budget. But because they always feel, oh, let's tell them this way, they will understand. Let's put them at this level, they will understand. And over the years, we have always been having patience. So anytime we want to take any industrial action, we have to apply brakes. But it looks like because we have been doing that for a very long time, our employers are now taking us for granted. Are they saying that 2 billion, let's even assume that it is true, that 2 billion is more expensive than the entire 35 million Ghanaians' health? Is that what they want to say? So is it only nurses who should sacrifice for the entire country? Ministers, MPs, chief executives, and all others, are they not taking their allowance? So why should the nurse have to wait? And the nurse is not waiting with the team players that he is working with or she is working with. The nurse is waiting alone. While those in the health sector, which form the health team, to make it a complete composite to render quality health services to Ghanaians, they would be enjoying their own. But when it comes to the nurses, that one, it will set the budget off gear. We just feel we are not being treated fairly. And what he said, they have asked retired nurses and midwives to come and support. Those retired nurses went home paupers. They are battling with cardiovascular diseases, musculoskeletal diseases, which they are using their meager pension money to take care of themselves. The state is not taking care of them. They go through the same frustrations that other members of the public go through. So to say you are calling on registered nurses to come and work, the solution to the problem is, it made a proposal yesterday. Start the implementation now. At least, if there are arrears and you think you cannot pay, you can discuss that one later. But to tell us to wait till next year is not something that we will accept.
Have you costed the demands yourself, though? The government puts it at 2 billion. Are you saying it's too much or too less, the amount quoted by the government?
The amount quoted is too much.
What is your own figure that you're working with?
We are trying to do that because we didn't know that this thing will come. So this afternoon, I was trying to get the various categories. So when I did the uniform allowance, it's just 120 million Ghana cedis. And that is one of the major expenditure, apart from the book and research allowance. But that is not also going to all nurses. It's just the nurse educators. The fuel allowance, that one is very difficult to quantify, but it is also for only the 3 top senior grades of the profession, and there are few. So let's take it that even if the fuel allowance per month is 2,000, the senior class, how many are they? That is the principal nursing officer, the deputy chief nursing officer, and chief nursing officer. Chief nursing officers, they are not up to 50. The deputy chiefs may be in their hundreds, and the principal nursing officers will be in their 100. If you put all of them together, they will not be able to, they will not be more than 15,000. And then this one, I'm being very generous. So it is not true that such an amount will be. There are some of the things they are supposed to be paid at the facility level.
So, Mr. Akogo, so you think that the figure has been overquoted? I'm sure in the coming hours or days, maybe you would come up with a figure that you believe is correct, so we work with that. Now, you said that 2 billion is not worth more than the lives of 35 million people. That may be true, but it is also true that if you do not factor an expenditure into your budget, you would be a reckless person if you went ahead to expend, even though it is not budgeted for. Are you asking, and they've explained that if they go ahead to do this expenditure, our targets that we have set, the reset agenda would be drowning. And so this is the best way to save it. As nurses, would you be able to perhaps also decide to say you're going to sacrifice this year so that next year you'll be put on this schedule and then we'll all be on the same footing?
Yeah, thank you very much, Umaru. We wish we could do that. But it's like we have done that over the years. Sometimes we just look at our patients and we relax. We don't push much. But this big insult, a proposal given to you, you fail to factor it into your budget. And you think we should take responsibility for that. And you think we should sacrifice for that. If we are going to do that, then it should cut across all public sector workers, all other people who are taking allowances. Stop the allowances, so that we will know that everybody is sacrificing, not only nurses. And some of the allowance the big people are taking. One category of allowance can pay 3 of our allowance to a young nurse or midwife. So the sacrifices shouldn't be shifted only to nurses. And we are pleading that they should let us solve this problem as quickly as possible. We can't sleep. We are worried. But the situation is such that it is very difficult to engage our members. There is nothing that we can present to them that will appease them for now. All the proposals that have been made, 1 year is gone. And the 1 year, we have only arrears. We are not saying pay us the arrears. We are in June. When they do a mid-year review of the budget, that is not a usual thing that they do. So we see these excuses; they are not tenable.
Let me ask you. Let me ask you one last question before we go. And sorry.
That's fine.
The government or the minister is begging retired nurses to come to the aid of the nation. You have said that they are in a far worse condition and that they may not come. But
Yes.
what if they listen to the call and they come? You would be losing your job. You'll be jobless. Are you not worried? Your salary this month, at least, you may lose it. And if they decide to come and do this volunteering, you should be worried for your job.
Yeah, for that one, this is not something that. How many are the retired nurses? They come out due to poor conditions of their life. Most of them go home very early. So how many are they? And they are our members. That is what the minister is not aware of. They are the nurses, retired nurses club. So they are inside our union. They are our members. Majority, 99% of them are our members. And we visit and meet them all the time. We invite them for our programs to make them still feel belonged. We have no problem if they decide to come and assist. After all, we are also not happy with the situation that is occurring in the country. So if they come and they are able to deal with the dire emergencies, it is fine for everybody. But it is not the solution to the problem.
Very well.
How long can they go?
Very well. Thank you. Thank you so much for speaking to us. Sir.
Thank you very much. I'm also grateful too.
By the way, information I have is that the government has secured a process from the court where they are going to serve you with the summons. We are told that you are evading service, and so they've gone for substituted service. So just be on standby. They may find you anywhere and give it to you. I mean, they may just publish it somewhere, and then it suffices as service to you. That's just by way of information to you, in case you have.
All right. We are law-abiding citizens, so if we are served, we will look at it.
Okay.
And do the right.
Very well.
Thank you too.
Thank you. That's Samuel Akolgo. He's vice president of the Ghana Registered Nurses and Midwives Association. Now, there's a related story. The Mortuary Workers Association of Ghana have an issue too. Richard Jordan is the general secretary. Mr. Jordan, you're welcome to Eyewitness News.
Thank you, my brother. Let me greet